so much. Thank you for being here with us, and thank you for your leadership and your vision in the state legislature, and really, I think, as one of our primary champions on these really important issues. So thank you again. Thank you for being in this fight with us. Next, I'd like to introduce our other awardee of the evening. We recognize at CPEHN that it takes great legislative champions, and it also takes great champions within the administration and our departments and agencies to move forward on the type of work that we want to move forward. So I'm very excited, thrilled really to introduce Dr. Rohan Radhakrishna, who was appointed by Governor Gavin Newsom to lead the Office of Health Equity, I guess almost a year ago now, spring of 2021, and was recently confirmed in that role by the state Senate. Dr. Rohan strives to uphold the universal values of love, dignity, and transformation. He believes that inequity in a world of abundance is morally and socially unacceptable, and he aims to advance partnerships to change narratives and power structures to help create a California for all. And just over the last year, I can say, in having the opportunity to work with him, we've really seen these values and commitments in his work. He has decades of experience working at the county level, working as a healthcare provider, working in county public health on a number of issues, and is really bringing, I think, that experience and that commitment to the state. We're very fortunate to have him in this position where he's already, I think, doubled the size of the office, been able to really be instrumental during the pandemic. And so we would like to present our second award, our CPEHN Health Equity and Racial Justice Champion Award, to Dr. Rohan Radhakrishna, and ask him if he'd like to offer a few remarks.
Thank you so much, Karen, CPEHN, Assemblymember Arambula. My name is Rohan, and I stand for love, dignity, and transformation, and have a similar story to Assemblymember Arambula of not being able to tolerate the downstream suffering one by one and the need to move upstream to address the systemic factors that can help create health. I cannot accept this award as an individual, noting I stand on the shoulder of giants who have been doing this work for decades, many of you attending this event today. But I am willing, as the new kid on the block, to humbly accept this award as part of California's health equity movement, which includes many who are both inside and outside of our institutions and government. Thank you, CPEHN, for this award. I'm so grateful for all of your work and partnership. Much has been said during this pandemic about the disparities and inequities experienced by people of color, those with limited English proficiency, people who are undocumented, differently abled, or who identify as LGBTQ+. But much less attention has been paid to the strength, resiliency, and innovative solutions that communities already held within them to face such challenges. From community vaccine clinics to educational webinars to serving as food and resource hubs, community organizations and advocates have been helping meet the needs of their neighbors long before the pandemic. The work of community reminds me of one of my newest favorite quotes that comes from an article on preventive mental health. Here it goes. Risk factors are not predictive factors because of protective factors. Let me say that again. Risk factors are not predictive factors because of protective factors. Community resiliency amplifies the protective factors to overcome the risks of systemic and structural discrimination and oppression that will take time to dismantle, rebuild, and transform. Thank you, community partners, for all that you do every day. I'd like to end by briefly honoring two of my mentors who I had the privilege to learn from and who passed away recently. The first is Paul Farmer, an anthropologist and physician who said, "The idea that some lives matter less is the root of all that is wrong in the world." He taught us to champion culture as health, to elevate grassroots expertise, and to empower community health workers, all things that CPEHN promotes in California. Second, I'd like to uplift the spirit of the peace activist, mindfulness master, and Vietnamese monk, Thich Nhat Hanh, who taught us about interbeing and our deep interconnectedness. A cloud brings rain, fills reservoirs, becomes our drinking water, enters our body, and as we exhale, that moisture rebuilds the clouds. We inter-are with clouds, and we inter-are with each other. Our suffering and our salvation is inextricably bound. COVID has brought us closer, for we can only truly be healthy if all community members are healthy. May we continue their work in the spirit of love and compassion. And I'll end by sharing my pride to be a partner with CPEHN in this movement, so we can together chart the course of history and bend the arc towards justice. Thank you.
Thank you so much, Dr. Radhakrishna, for those really powerful words and also for bringing some of our ancestors and leaders into the room with us. I really appreciate that and appreciate your leadership and partnership with the state. So thank you so much. I'm now going to turn it over to my colleague, our Managing Director of Policy, Ronald Coleman.
Thank you so much, Kieran, and thank you, Dr. Radhakrishna, for your kind words. We very much appreciate all your work and leadership. Ronald Coleman here, Managing Director of Policy with the California Pan-Ethnic Health Network. I'd now like to introduce Dr. Richard Pan, Senator from the 6th District representing Sacramento. Senator Pan is the author of CPEHN's sponsored bill, SB 1033, which seeks to enhance and standardize data to improve health outcomes. Senator Pan, I'll turn it over to you.
Well, thank you so much for the introduction, Ronald, and thank you so much for having me and being part of this wonderful 2022 policy kickoff event for CPEHN. And I do want to congratulate the award winners, both Drs. Arambula and Drs. Rohan. Really appreciate your remarks